We don't know what to trust right now. Words shared by ICU nurse Michelle Fairney in regards to the COVID-19 pandemic. And this is the state of our world right now. It's a state of not knowing all the answers, which is incredibly uncomfortable, whether you want to admit it or not. This is why so many people, including yourself, are likely to hit up traditional media or social media because you're seeking out the answers to help you feel more safe, secure, and comfortable. Whether it's a conspiracy theory or an announcement from the White House, you're clinging on to these so-called answers while avoiding gaining a deeper perspective on what you're truly experiencing. In this episode, Michelle and I dive into a conversation about the pandemic, the uncertainty, and what's really taking place on the front lines. This is not an episode where you're going to find the answers. This is an episode for you to deepen your perspective on what we are collectively experiencing. So tune in and expand your perspective on the virus itself, on herd immunity, on the possibility of virus mutation, and on the people who are getting hit by COVID-19. Michelle Fairney is an intensive care nurse and self-care expert who helps nurses cultivate inner resiliency so they can live a life they truly love beyond the bedside. From dealing with the complexities of critically ill children to working front lines at the epicenter of New York during the COVID crisis, Michelle mentors other nurses as they navigate the emotional, psychological, and physical demands that nurses face daily. Michelle has experienced life-altering degrees of burnout, anxiety, and depression, and after almost quitting the profession completely in 2017, she realized self-care goes beyond what is prescriptively taught to nurses: exercise, eat healthy, and take a bubble bath. Michelle has made it her mission to teach nurses how to be a nurse, as current education only emphasizes the to-do and task-oriented side of nursing. Yet the profession itself deeply calls nurses forward into their most vulnerable and compassionate form. This is an episode that you're going to want to bookmark, listen to, download, share with friends, because I can guarantee it is going to shed some deep perspective on what we are experiencing in our world right now. Now, whether you are new to the podcast or a loyal thought leader, please hit pause right now and take a moment to download a few episodes and drop a rating and review on iTunes. This would help me out a lot. And if you dig the podcast and you want to connect with me, add me on social media at I am Ruby, or shoot me a text message at 1-781-336-0160. Now it is time to gain some perspective on COVID-19 with ICU Frontline nurse Michelle Fairney. Hey, thought leaders, I am back with a very special episode with a very special friend. And before I have her say hello, let me just share how we know each other. So I don't even know, maybe it was like 10 years ago. What is it, 2020 right now? It was, I would say, maybe
10 years.
10 years, maybe even longer, 12 years.
Mm-hmm.
I started working in nightlife 12 years ago. I was a promoter and Michelle was a frequenter. I mean, I don't know. Is that a good way to put it?
I don't know. I was really going to be surprised what you were going to say there. I was like, oh, party girl.
Oh, I mean, we could say that, but a club frequenter, a party frequenter. Yeah. And that's how we actually initially connected. So we knew each other in very different points in our lives where we were completely different people with completely different lives. And funny, like we had just really reconnected last year when Michelle signed up for my retreat, and we realized how parallel our lives were back then. Like, I don't think back then we realized how parallel our lives and our relationships were. And then we dove in last year and it's like, oh yeah, we were going through the same shit.
Yeah. And I mean, that's so interesting because when we're in those places in our lives, we tend to be so secretive and so covered up, right?
Totally. Well, with that introduction, I'm super excited to bring Michelle Fairney on the podcast today. And in this new life of hers, in this evolved place in her life. Michelle is an intensive care nurse and self-care expert, and just an all-around genuine, authentic, wonderful human being who I deeply admire. I'm inspired by her, and the work that she's doing in our world is so, so important, because by supporting nurses in being their best selves, she's also creating a ripple effect to shift the medical industry for the good, for the better. So Michelle, thank you so much for being here and for sharing your time and presence with us.
Thank you for having me. No, I'm so excited to just dive in. There's so much that I really feel that like going on right now in our world, and we're all in our own little mini worlds, and we're just getting tastes and bites of what we're seeing. I can even speak to that. I've been living in the world of Frontline's COVID for, the last 2 months, and just starting to resurface again is what I'm starting to feel like, and sharing what it is that I'm seeing on a day-to-day basis is going to be something so important, I think, to, really create a depth within all of our perspectives of what's going on. Because also even us who are in healthcare and working the front lines, when we start sharing our stories and we start understanding one another, it also allows us to get outside of the very like tasky to do side, the very life or death, the very like go, 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 and start seeing everything as a whole again.
Yeah, that's a really good way to put it, how we're all in our own bubbles, because everything does seem super fragmented right now. We have people living in isolation, social distancing, people on the front lines. We have a lot of stuff happening in social media. We're getting hit from all sides of the spectrum, and a lot of people are feeling like they're alone in their shit. But when you're in that space, it's really easy to lose that depth and the perspective of what's actually happening. And in that loss of depth and perspective, we seem to be losing compassion and empathy, and also the ability to trust ourselves and our intuition. We were talking about this last week, how with COVID, this has really been challenging to a lot of people in terms of their basic human needs. Basic human physiological needs and safety needs have been challenged for everyone in different ways, and people are clinging on to anything, concept, idea, belief, ideation, person, leader, media outlet, whatever it is, that provides them with that sense of security. But in doing so, they then turn a blind eye to everything else. And that's why I had, so I reached out to Michelle a week ago, because I watched this, there's all these nurses sharing videos right now. And this one had stood out for some reason to me. And I really just wanted to hear Michelle's perspective as a nurse. Like, what is this really what's happening? And it was the video that was saying, where the nurse was saying, the hospitals are murdering patients. And that's when Michelle and I dropped into a really deep conversation that inspired this podcast episode. But it's like headlines like that I feel are disrupting our ability to see the truth. Plus, it's like really easy to want to believe that, because now you have a finger to point at, you have someone to point a finger at. Right? Oh, it's the hospitals that are wrong. Okay, so they're fucking up, and this is the reason why so many people are dying. Great. I'm going to believe that. It's crazy.
Yeah. And I mean, I feel that exactly what you said right now, this is a time where we're becoming more disconnected from ourselves and our truth, and also disconnected from others, and disconnected from a lot of our systems and things too, because we don't know what to trust right now. And so exactly, when you have media that comes out that uses the tone and the language of murder, and it comes from a very, again, limited perspective on the entire, like COVID situation as a whole. This is one nurse speaking from one lens of perspective, coming into a crisis zone, who only has worked in the one hospital setting. She hasn't seen all the other hospitals. And it just speaks to, again, how that then can translate into more disconnection. we know that this for fact is that people are not coming to the hospital right now because they're scared to. They're scared that they're going to get treated like a COVID patient, or they're going to catch COVID, and it's going to change their course of outcome. There's been people that have been dying from things that our system was already overwhelmed with prior to COVID. And because there's now this huge, disconnection from healthcare and seeking out any sort of help, and people, sheltering in place, we're also seeing those other things and those other like diseases like heart attacks and strokes and things that do happen on the daily are now getting missed.
Yeah, it's really sad. And I think that's the piece that keeps getting me. Like, this is the reason why I keep going on and off social media, because I get really emotional when it feels like people are missing the humanness of what's happening. Like, who cares why? But this is what's happening. Because I think at the end of the day, would you agree that it's safe to say we don't know why all of this is happening, because we don't have all the answers?
And the thing is that we might not ever have all of the answers. And even when we do get enough answers to then like put that in a place in our memory bank and store it as, okay, that's kind of what happened in that period of time, it's always hindsight. Like, you're not going through shit as you're going through it, and you learn the lessons after the person who's going through it goes through it, and then you learn the lessons. That's with anything in life. And so it's just very interesting in this time right now how many people are surfacing and being these like experts in things that we don't know. Like, this is a novel virus, meaning that it's never existed to this point.
Can we break that down first? Like, let's just break down the definition of a novel virus.
Yeah. So novel virus, meaning that this virus has never surfaced. It's never been around to date. There are other coronaviruses and other strains, just meaning that the makeup of the virus is different. It acts differently. I'm actually a pediatric ICU nurse, and I deal with coronavirus every year. Like, we have children in the ICU who are intubated for a different type of coronavirus, but this is not the same one that we're now seeing. So this is a novel virus that's affecting the adult population predominantly. And so when it's novel, it means that they don't know what to do with it. Like, it could behave in so many different ways. And when we don't have information and we're treating from a place of just putting out fires, it's really tough. We, just like the general public, experience that same sort of like waves of uncertainty. Like, we're getting information on the daily. I remember in the beginning there, it's like every day I'd go into work, there was new things, changes, new policies, new ways that we had to like put on PPE. Like, everything is changing, everything. And it's so much like, it also shows like that outer side of things. And it gave me I'd say more depth to my perspective too, as to why so many people aren't coping during all of this, because our human nature, like our DNA, like our nervous system, we do not like new things. We do not like things that we don't know, that are like, if we can't see the entire staircase.
We don't like the unfamiliar. We don't like the uncomfortable. We don't like the unpredictable.
No. So then we create little things to kind of just soothe ourselves, to get by, because it's really, truly hard for us to sit in an unknown. It's much easier to say, hey, look, that person who, says they're a doctor. I mean, like, also let's understand that you can have a PhD in like exercise nutrition and
and call yourself a doctor,
and be speaking about virology and tests and different things like that. It's very easy to look at people where we feel that we have a deficit and where we doubt ourselves and seek information from them, because then it creates that filling, that like place in us, that void where we're just trying to use another person and their information to fill a hole in ourselves.
Yeah, we're grasping for information to fill in the blanks within ourselves so that we can create that false sense of security and safety, right? Like
Yeah.
if Dr. So-and-so's beliefs about what's going on makes us feel somehow safer because now we have an answer, then I'm going to hold on to that.
Mm,
Or if the media,
yeah.
what the media is saying fills in some of the blanks that I'm questioning and that makes me feel more secure, then I'm going to do that. I'm going to do that, right? And
Yeah.
it feels like we
Or
have, yeah, go on.
yeah, I was just going to add to that. It's like same thing with that nurse video calling,
Right.
it being like then taken and then, all like she didn't necessarily say murder, but then, all the people repackaged it and repurposed
Yes.
it as murder. Exactly. So what it then does is it creates the like understanding around why are so many people dying right now? Oh, it's the
Mm-hmm.
hospitals killing them. Therefore, I just won't seek medical attention and care. Like it's just like, oh my gosh, this is really
Mm-hmm.
happening right now. Yeah.
Yeah, it's so convoluted. Like everything
Mm,
feels convoluted. And personally, for me, what I've found is the more time I spend online, the more convoluted things get. And so I have
mhm,
found refuge being offline and being with myself
mhm.
and being in my practices and just like being in nature and not paying as much attention to what's going on online that I was before. Um, and there's also, the online space is also really helpful right now in order to stay connected with people. So it's like
Yeah.
you got to find that balance. But I think at the end of the day, for me personally, it's been okay. What actually truly resonates, like what actually truly feels um, good and doesn't agitate my nervous system versus like
Mhm.
what are the things that are being said that are agitating my nervous system. And I've done my best, honestly, to show up and speak to this, and shit still gets twisted, like because
Mhm.
people are seeing what they want to see and hearing what they want to hear, because again, like they're going after trying to fill in the blanks or seeking out proof to prove their beliefs or ideations as the truth. um, Something I want to segue into is because I think this is so important, because you helped me so much in our last call, and I never told you this, because we hear about the stories that are happening in the hospitals, right? Like I read a lot of the like opinion sections in New York Times and things like that to get some of the personal stories. But then again, you're questioning, like, okay, well, which is this edited? Like, is this not the truth? Like, what's actually happening?
Mhm.
And so to hear more about what's actually taking place right now in the hospitals from someone I trust was really insightful. I
Mhm.
found myself checking myself like a few more times, and also dropping into a deeper state of compassion. And I think it would just be helpful for our listeners to hear what you're able to share, of course.
Yeah. So what I can personally share is that I am working currently and still as a travel nurse. I am working on the front lines of a very large hospital in New York City. I am working in the intensive care unit, and I am working on a life support unit, meaning so there's quite a bit of a difference between that and someone who hasn't actually experienced intensive care might not understand the differences. So I will go over that.
Mm-hmm.
So generally what happens is when you become sick, you go into the emergency room. The goal of the emergency room is to treat you and figure out what's wrong with you, hopefully give you something so that you don't need to get admitted. You can go home, send you on your way, you're good to go.
Right.
Now, if it seems that they can't fix you in, whatever X amount of hours, then you would get transferred to something that we call like the ward, the unit,
Mm-hmm.
which is just a regular medical ward or whatever it might be, or a surgical ward if you need surgery. And it means that like you're not in like dire strait, like you're not going to die in the next like 6 hours, or like,
Mm-hmm.
it's more so that you just need a little bit more treatment. We're not safe and we don't feel safe and comfortable with you going home.
Mm-hmm.
Then there's intensive care unit. And the ICU is basically a place where it's like you need emergent care, you need intense monitoring because your condition can change hour by hour.
Mm-hmm.
So the intensive care unit is no joke. Like, that is somewhere where you go because you need highly skilled professionals, highly skilled people who have not only just done the book smarts, but they've experienced it. You know,
Right.
they know how to work with this type of medicine. They know how to work with the body. And, you know, when I speak to this in like with a lot of other my colleagues, is that the intensive care unit is a very special place because it's where science and the soul meet. Like,
Mm.
you have to be checking yourself religiously. And I mean that in the sense of that, you know, goals of care always change. So COVID itself has been very interesting and has called on our resources big. Like, we know this. We know that, you know, there hasn't been PPE, there hasn't been ventilators, there hasn't
Mm-hmm.
been all these different things. But what I feel the general community and people don't understand is what happens when care becomes diluted.
Mm.
And what
Yeah.
I mean by that is that, you know, the lack of resources that we can't just replace, or we can't just, like, you know, get all these other companies to start making, is human.
Mm.
There's only
Yeah.
very few of us who actually do this practice and do this type of science. And it takes a long time to go into an actual ICU. You're training, if you already usually have at least 2 years of regular nursing experience, and then you go through a 6-month intensive training program that requires you to go back to school, as well as then do clinical and have be mentored for that entire period before you get to actually freely be in the ICU, because these patients are very fragile. Like I
Mm-hmm.
said, they can change from hour to hour. And so this was the big thing that we were seeing in the beginning, is that we had way too many critical patients and not enough critical care beds. Now, the facility I'm working at is just one hospital in New York City.
Right.
And to put into perspective how many critical care beds we needed, is that each floor has 32 beds in it.
Mm-hmm.
And they converted floor 12 to 17 all into ICU.
Wow. And before that, how many floors were ICU?
I would say one collectively,
Wow.
but spread out throughout the hospital, because
Right.
they usually separate them into like cardiac ICU and then like surgical or like medical ICU.
Right. But there's no separation. It's just all ICU.
No separation. And so the thing is that when dilution of care happens, the quality of care goes down. This is
Yeah.
something as nurses that we've been striking for years. You know, you've seen in the media from time to time nurses striking and, you
Mm-hmm.
know, on the like picket lines and on those front lines, like asking for what the general population probably doesn't understand is better nurse to patient ratios.
Mm.
And typically what then happens is that it's looked at like, we want more money, we need more money, but really it's, we need more money for hiring and for more people, because the quality of care goes down. Because think about it, when you're busy and you're running around all day, you're not spending time being present. You're not very aware. You're in fight or flight. You're missing information.
Right. So what you're
You're
saying, like, because I want to
disconnected.
simplify this, is like prior
Yeah.
to COVID happening, there was already not enough nurses for patients.
Yes.
Right. Okay.
Exactly.
And so now with COVID, with the influx, especially in New York City, now that ratio becomes even more diluted. Now you don't
Yes.
have enough, especially in the ICU, not enough nurses who are trained for those
Mm-hmm.
specific reasons to
Mm-hmm.
to work with these patients.
Yeah. And so that's a big thing that we are seeing. So in a typical ICU environment, you are one-to-one with your patient, meaning one nurse to one patient,
Mm.
because the care that they need is a lot. In the beginning there were sometimes 3 patients to one nurse.
Wow.
And that's a big thing, especially when you don't know how to treat this virus and how this virus works, and, you know, at what stage you need to be implementing certain things. I've spoken to a lot of my colleagues, and I've talked to a lot of my friends as well. And, you know, even us who do work in ICU, we know that this type of patient that comes in with respiratory ventilator, like, you know, develops ARDS, which is the massive inflammatory response around the lungs that causes a lot of issues for ventilation.
Mm-hmm.
They're usually one of the sickest patients on our unit.
Mm.
when this happens.
Yeah.
And or there's also when we have these sometimes patients that come in that are a medical mystery, we don't understand why they're so sick, and we're just trying to put out fires until we can gather more information. They too are also the sickest patients.
Mm-hmm.
And even when we're in the ICU, we have typically other patients that are a little bit more stable. So if you're nursing this really sick patient, you usually have support of your colleagues.
Mm-hmm.
But right now, these very sick patients are filling up every single bed.
Mm.
So everyone is stretched thin.
Yeah.
They've called on doctors who don't specialize in these areas, just because we can't do anything else at this point.
Mm-hmm.
You know, they're training staff as quickly as they can. They're, you know, bringing in, like, you know, my facility brought in 400 travel nurses.
Wow. 400 travel nurses.
400.
In addition to their staff.
In addition to their staff, yes.
Wow. And that's because they could. And not a lot of hospitals
Mm-hmm.
have the resources to be able to do that, which is why there are some hospitals in New York that are suffering more than others, and in other places in the world that are suffering more than other hospitals. Yeah. And I think, you know, for listeners, I hope that gives you perspective on what is actually happening on the front lines in terms of not debunking, but shedding some light on some of the videos that are being shown. So rather than, you know, getting upset at what's being shown, like, let this be an eye opener to how our healthcare system needs a makeover anyways. And it needed one prior to this. And COVID is actually highlighting in a very traumatic way just how much the healthcare system here needs to shift in order to be able to support you know, the people who come into the hospitals.
Mm-hmm. Yeah. And that's really a big thing too. You know, this virus itself is also highlighting a lot of things that we didn't know. We're starting to see, and especially for me, I'm working on a unit where we're actually dealing with the population that isn't the, like, you know, older than 70, has the comorbidities and all the things. We're dealing with the young ones. My patients are all under 45, and some of them are coming in with no previous medical history. We're seeing, you know, really sadly enough, it's like the influences of socioeconomic status, you know, different, I would say, like, we're seeing like Hispanic is very highly affected. And we're now starting to see that obesity is becoming another comorbidity to be considered in this. And so it also poses that question, because there's also so much, you know, backlash out there being like, why do the healthy people need to stay in quarantine? It doesn't make sense. But it's like, how do we define healthy even? You know, we can't do it based on age. We can't do it based on you've never been diagnosed with something. The body itself is so good and resilient. It's so good at, like, maintaining and looking like it's good until it's, like, really not good anymore. You know, like, your liver will function up to 75% of its capacity before it actually fails. You know, your kidneys as well will go to 80% before they completely fail. Yeah, so there's all these things, and it's not to scare people, because that's not my intention within this. It's just to kind of bring a deeper understanding that the reason we can't just let everyone out who defines themselves as healthy is because we don't know who's healthy. We don't know who is going to be, you know, one of the people that just doesn't get symptoms, doesn't, you know.
That's really important for everyone listening, because there are a lot of people questioning that. I've questioned it, you know, like, why do us who feel healthy and do our best to maintain health also have to stay home and lock down? And there is a lot that we don't know, and there are things that perhaps you have that you don't know you have, and there's just so many unknowns right now. And what Michelle is highlighting is the fact that, you know, she's working on a ward where people are under the age of 45, seemingly healthy, never had previous health concerns before, and they're there. And it can be easy for you from the comfort of your homes behind your computer screens to point the finger and say, oh, they must have had some heart condition, or oh, they must be obese, or oh, they must have this. And yet you don't know that for a fact. And what Michelle is
Mhm.
saying is that, like, there isn't, and correct me if I'm wrong, there isn't like a concrete predictability for who this is going to
Mhm.
affect just yet.
Yes,
Okay.
exactly. And then like this whole thing is just so like multifactorial in that as well too. You know, we talk even about like, okay, so projection moving forward, like what are we going to do with this? Because at this point, I mean, New York has been the big highlight of
Mm-hmm.
like, this is what happens when, you don't identify people ahead of time and things go wrong and, the system becomes overburdened.
Mm-hmm.
They're now estimating that New York has only 20% of its population infected. That means that New York needs to go through this 2 more times in order to achieve natural herd immunity if we were going to go that route.
Okay. Can you explain that a little bit? Because I think there's a lot of people who have been talking about herd immunity,
Mm-hmm.
and immunity in general, because, there's the saying, well, if I got it once, I won't be able to get it again. Right. So let's break it down, because you also shed some light on this for me that made me open my eyes and question some of the people that I've been following who have been speaking about herd immunity.
Yeah, so I will speak to my level of my knowledge. Like, by
Yes.
no means am I like a virologist or like, infectious disease. I did do, previous to my nursing degree, I did do in my undergrad, I did a pre-med degree, and I did a lot of my specialty in population health, and did like health science and that sort of background in region. So I do have some familiarity around like what they're talking about when they're thinking of like, these certain concepts. And, we're also taught around herd immunity and understanding that. Because the thing too is that you hear herd immunity and one person will be like, oh, that means like, natural herd immunity,
Right.
where also vaccination, we also talk about that is also to achieve herd immunity,
Okay.
to vaccinate people, to give them almost the pseudo experience of experiencing the virus without getting sick.
Right.
I know that's going to cause a lot of triggers, that one.
Yeah. Maybe we can
So
circle back to that in a bit.
we'll circle back to that
Yeah.
another day. But so the thing with herd immunity is essentially the rate in which that we need an entire population is about 60%, that then the vulnerable people who can't catch the virus, because if they catch the virus, they're going to die,
Mm-hmm.
or have whatever reason they can't get a vaccination. This is like in the sense of like the other things that we vaccinate for, will be protected. It
Mm-hmm.
means that the transmission rate of whatever we're protecting the other 40% from, it's so low that the likelihood of them catching it becomes way less.
Mm-hmm.
So the goal is 60%. Now, where we're at with COVID right now is it's kind of, but again, complicated. It's
Right.
unknown. We don't know how this virus is even going to act.
Mm-hmm.
So the goal that we would say with any major virus, or anything that's causing this amount of deaths, just like the flu does every year, is let's create a vaccine for it so that we can achieve natural herd immunity in a very like controlled way. Right? That's that one side's perspective, is that instead of subjecting the entire population to it
Mm-hmm.
and it just going to kill everyone it's going to kill, let's
Right.
try it this way to try to eliminate that and also eliminate the burden on the healthcare system, et cetera, et cetera. Now, the thing with vaccines, though, is that they take a really long time to develop.
Mm-hmm.
Because the side that we're also not sure with this virus is that how long does it create immunity for? We don't know if it's going to be, because it is an upper respiratory tract infection. It's something that's in your nasopharyngeal airway. You usually only really get like an annual sort of like free pass once you get it,
Mm-hmm.
and then your body gets rid of that. So it's also questionable that, they start developing these vaccines and they won't know until about a year from now whether the titers, which is like the amount of antibodies that they will actually look in your blood to see,
Mm-hmm.
whether they're actually still at a height where they're like, oh, okay, after a year, you still have antibodies. Because guess what? This thing hasn't been around for a year yet.
Right.
So we don't know until we get to the year point. We don't know until we get to the 2-year point. We won't know until we get till 10 years from now and be like, oh, okay, COVID's one of those ones where you can vaccinate once for, and it's good.
Right. Versus like you vaccinate and then you get the booster and then you get the other booster and then you get the fourth booster. Yeah. It hasn't been around. I think that's the thing that people are missing is like, it has not been around that long. Like it really hasn't.
Mm-hmm. And so then the other side of the coin is this whole like natural herd immunity thing where, you know, get more people to have the virus. It's going to start moving its way through. It will have less hosts to like infect that way. And the problem with that is two things, is that, again, we're just going to be back at like overwhelming our healthcare system. And exactly, you know, to kind of bring back that video of talking about murder in the hospitals, I wouldn't coin it as murder, but definitely there are going to be more people that are going to die because they won't receive the level of care that they need for this virus.
Yeah.
So that's the issue with that, is that there's going to be so many people who identify as healthy because so many people don't realize they're unhealthy until they start making better choices or something happens to them that checks their reality and they're like, oh, wait, I'm not healthy. So
true.
that's the issue with that side of things, that we don't know how many people that if we just let everyone run free, like there's going to be a lot of people who will who will need medical care, but we won't be able to offer it to them. So it's like, how many people just even needed a little bit of support of oxygen, you know, a little bit of like nutritional support, oxygen, some repositioning, and, you know, a little bit of azithromycin or something like that. Because that's some of this population too. People are coming into the hospitals and they're not in the intensive care unit, you know, they just needed a little bit of support moving through the virus. So it's very like kind of icky when it comes to those waters, when it's more playing with that side of like, well, like it's basically like lighting a match in a very, very dry forest. So basically like have a small little campfire and it doesn't go beyond that, or it just goes like wildfire. Right. And that's why there's also so much of this like really big hesitancy around reopening, is like, we know that you can't just hold everyone in until there's a vaccine or there's a controlled way to like, you know, do that, because then also too, people have their right to, you know, vaccinate or not vaccinate. They also don't know enough about this virus, about, you know, at what quarters do they need to vaccinate. They don't even know at this point if the virus is going to be a seasonal thing, because most coronaviruses are like, I mean,
and we haven't gone through a year. And so we still have yet to go through like another
on summer.
And so we, you know, on the Western hemisphere still have to go through a winter with it, like a full winter. And it's just like, it's crazy. And, you know, going back to the herd immunity piece, you know, it's so easy, I feel like, in this pandemic to want to pick a side, you know, whether it's the conspiracy theory or what you're reading by the government and the media, or like herd immunity or no herd immunity. But I'm hoping that our listeners by this point understand that there are no sides, and that in fact there's just this giant gray area of uncertainty that we get to navigate right now and be in right now. And this is learning how to be in the discomfort of all of that, because wouldn't you rather be in the discomfort of not knowing everything versus a false sense of comfort by clinging on to what could be truth, but it could also fuck everything up.
And just one other piece around the natural herd immunity side is that the other worry about, like, you know, allowing for natural herd immunity is that, especially with a virus that moves so quickly between people, like viruses, like they can change, you know, they can mutate. And so the thing is that with something that can pass so quickly, it can move through that many bodies that quickly, its likelihood to mutate is greater than a virus that doesn't move as quick. So the problem with that is that, do you want to roll the dice that it mutates into something worse that's even more deadly? Or do you want, like, versus it could mutate into something else that's not as deadly? Like, those are both possibilities, but you see, it's like a complete Pandora's box. This whole thing that we're in right now. It's like, how do we move forward? Because people do need to move forward, like I talked about before, about people not seeking proper medical attention and, getting cared for things that aren't COVID related. That's also causing a lot of like health issues and problems. People being stuck at home, kids not getting education. All these things do have cumulative effects.
Mm-hmm.
But at the same time too, it's like, how much do we give? How much do we take back? Like it's a dance, just like anything in life right now. It's just a very big political, out there in front of everyone's face dance that everyone's doing.
Yeah, that we're all trying to navigate, and many are trying to control and or claim the rights to. And it's it's really interesting because I've been in this deeply observational state, and I've talked about this on the podcast in the last few episodes, where I've really slipped on like the observer hat, and I'm observing a lot of things, and I'm not being quick to believe one thing over the next. Instead, I'm getting curious because curiosity feels good. But with curiosity also comes being in the uncertainty of it all and not having all the answers. Yet curiosity is what can get us closer to having some form of answers. But it's like people aren't willing to be in that place right now, for whatever their reasons. I mean, they've just got some shadow work to do is what I think, but
very agreeable to that one.
But yeah, it's so interesting. And I think that with the theory side of things versus, let's call it, traditional media side of things, we have the theory side people who are acting in certain ways, and the media side people who are acting in certain ways. But if you look at both sides, neither of them are comfortable in the uncertainty. Neither of them.
And that speaks to what we were talking about with the shadow work and what you were saying earlier, is that it comes down to self-trust. To sit in the middle and to walk the middle line is really uncomfortable, because you have to be willing to be wrong. You have to be willing to change your mind every single day. And our body will literally program that as death. Like our nervous system doesn't like that. No. Like it's so much easier to just be like, okay, I got this one thing, and then I'm going to stick to it, and then I'm going to build my little life around it and keep building my life around it. And that's how we get rigid and stuck in our ways, people.
Yeah.
And that's the thing, is even as a healthcare provider, even going through what I realized that I was so immersed in the front line that on my days off, like I've been doing self-care, and then I've been actually like immersing myself in all the things that are happening outside of my bubble to kind of grasp an idea and get a larger sphere around me of what is trickling in versus like what I'm seeing and then what's being experienced on the outside. I spend days where I go down the, rabbit hole of the what's called conspiracy theories. As well as I go and I, fill my head full of Trump and all that media. And it all it really does is it gives me more information to balance myself in that middle zone, and find exactly like, what is my truth, as someone who does operate in this system, who, we've talked about, from me being Canadian and now working in a US healthcare system that is very pro-treatment, finding how my morals and my values align me while I'm moving through this, to what degree I'm treating versus harming. And this is where I was talking about earlier about the ICU being this environment of where the science and soul meet. You have your, like, at one point you're working with these patients, and there's this like, you're going to get this done, you're going to optimize, you've got fighting chance. But the scenario can flip very quickly. The scenario can then flip into, we have all this technology and all these machines and all these things that we can keep you alive on, but are you really alive? Because we can do something, should we be doing it? And so that brings in the many layers as well. And so that's, for me, that's where I've learned how to actually really walk that middle line, because, the push and the organizational push, or, a lot of people in again, coming back to the trauma work, that like achievement and that winning mentality, especially with this like whole thing becoming like a war, you know, it's got really like war mentality stapled on it, that we have something to win. You can see that I'm working on that one right now, where this is just something that's happening. You know, it's inviting us all forward in so many ways. And for me, I've been really blessed that I found myself in a space where I can now really do that switch quite fluidly, where I can really jump in and stand, you know, against the very pro-treatment side and be like, no, like this is where we're at. This is what we need to reassess. These are the conversations we need to have. And I can also then go the other route and, you know, help motivate and inspire when there's still hope that someone's given up. And it's a big hat to hold. And I think that speaks to just exactly how we need to sort of operate when it comes to this, is that there's always going to be information on either side, and our own inner work and our own perspectives is going to have us running forward, usually more leaning to one side. And if we don't stop ourselves and check ourselves and open our minds, you know, to the information that's going on around us, then we don't actually see the situation for all that it is.
Yeah. And, you know, it's the way that you describe how you've been seeking information via media or social media, whether it's like Trump or the conspiracy theories, made me think about the concept of like truth versus perspective, how I think a lot of people are going online to seeking out the truth versus like seeking to gain perspective. And that there's a big difference, because for all of you listening, your truth isn't going to be found in social media, nor is it going to be found in the New York Times, nor is it going to be found on the news. It can only be found within yourself. But by going to these different outlets, you can sure as hell gain perspective. And that's one of our intentions for you today. I'm sorry if you came here to find some solid answers, because we're not giving you answers, but we're hoping to offer you some perspective to think differently, to open your mind, to go from such a magnified laser focus on one thing to just panning out and being able to see all things and shed some more compassion and empathy into our world, not just for others, but for yourself, because being in the uncertainty can feel really, really awful. And so we get to have that grace for ourselves and that compassion for ourselves, but don't go to outside sources to seek out truth, because that can only be found within yourself. But you can go to outside sources to seek perspective on things, to deepen and widen your perspective on things. That's great. And then do so from that place of like curiosity and sheer observation versus the energy of like, oh, no, I need to know this now, which is what brings us into those rabbit holes that we've talked about, right? Like you'll read something somewhere and you'll be like, oh my God, I need to fact check this. And then you go somewhere else and I need to check that. And you go somewhere else and all of a sudden 10 hours later, you come out of the rabbit hole and your whole day is gone. And you're like, wow, I feel like shit. I've been
like,
there.
I don't know what's real anymore.
Right. But that pulls you out of your truth, because you were in there chasing the truth versus chasing perspective. Yeah, so important. So sorry, guys, if you were listening to find out some sort of truth, that can only be found within yourself. I'd love to know if you're open to sharing one or a couple stories. I know there's privacy and stuff, but of patient care, only because I want to offer people perspective. I think that there is something powerful that comes from sharing human stories, because it again brings the humanness back into the situation, which I think a lot of people are missing. Is there a way for you to share? And it's okay if you can't.
Yeah, so I think I can kind of summarize it more, so they're not necessarily patient-specific scenarios, because I have to stay away for that. But I can just kind of, talk about the experience. And in its entirety.
Yeah.
So we already spoke about, these overwhelming ICUs there's more ICU beds now than we need, or that we currently have, like, or prior to this needed. We have a lot of people working hard, and respiratory patients, which is, the lungs, they're very sick and they're very fragile, and they change from hour to hour. It's not like surgery. It's not like all these other things that when you nurse these patients, the very like standard, like pathology of it. Okay, this is going to happen at this time. We need to give this, we need to give that. It's a very like ebb and flow type relationship. So when it comes to these patients, and especially the floor that I've worked on, I talked about life support. So the difference between being on a ventilator and being on life support is that a ventilator is, you have either an endotracheal tube, which is like a tube that goes down your throat and breathes, and the machine does the breathing for you. And without getting too complicated, that, you can do some of the breaths on your own, but for the most part, with how sick these guys are, the machine is doing the breathing for you.
Right.
Now, life support is different. So it's called Ecmo. And when we put someone on Ecmo, essentially what it is that you get these two large cannulas. One goes in the upper neck and one goes in the groin. And it's actually, you prime the system with blood, which again is another scarce resource that we never had prior to this going on. And now are having to use. You prime the system with blood, and you are taking the blood out of the person into a machine. It's oxygenating it, clearing it out. We call it sweeping, and then putting it back into the human again.
Wow.
And we're doing this because their lungs have incurred so much trauma that putting a ventilator down there, we can't even give them oxygen. We can't even breathe for them. And their lungs have become so fragile that if we try to put breath into there, we fear their lungs are just going to continue to pop. And this is true. We're seeing this. We have a lot of patients with chest tubes right now because we're finding this balance between, we can give them enough sedation and put them into like a chemically sort of like sleepy type state. And it's also good for their lungs to allow them to do some of their own breathing and work on that mechanical side of things to keep their muscles strong for later. But we're also finding when it comes to this is that there's something called self-inflicted lung injury, where if you don't sedate them well enough, they go into a coughing fit, they can actually pop one of their lungs. That's how fragile the tissues are. So yeah, it's been really interesting to nurse because, like I said, I'm working on a floor where we're seeing the 45 and under. We're basically at this point only allowing patients 45 and younger to go on life support.
Wow.
Because we have filter shortages, we have blood shortage. It takes a lot of people and humans to run this life support machine. And the patients that we're seeing in these states during COVID, they are in the hospital admitted for upwards of 4 weeks.
Wow.
Like so they're in our beds for a long time if they're not, passing on and relieving a bed earlier. So it's a lot of hours, a lot of time, a lot of dedication. When you have patients this sick, you're constantly monitoring them. Then you're also having to do a bunch of things for their body that they'd be doing if they were just normally walking, talking, and moving around. You have to turn them every 2 hours. You have to reposition all their body and their mobility. Otherwise, their muscles, because they're in such a massive stress response, because the infection is so severe, they start going through atrophy. Their body is just breaking down being in these beds over time too. So a lot of our patients is like, their lives have changed forever when they come out of this. They're coming out of this. Yeah, they were a walking, talking, completely normal functioning 40-year-old man who now has to go through rehab for the next while. When you are, you do have a ventilator, there's other risks that happen with that. Like, it's not just let's throw a breathing tube in there and we're all good. You have to manage the rest of the body. And And there's so many things that come with that, is that you can get a pneumonia from having a ventilator in there for too long, which that complicates your disease process even more, and causes bacteria in those already really fragile lungs that are so close to those blood vessels, which then can create sepsis. And sepsis is like something that you have to treat like immediately. So it's not something that we cannot take serious right now. Like it's hard for me because I am someone who values freedom so much. And, you know, being a travel nurse is so that I can nurse for like the few months at a time, and then like, you know, travel and do different things and have that kind of freedom. And so I can totally empathize what it feels like when your freedom is being taken away from you, but also having the privilege to see what people are going through when they, you know, this virus knocks on their door and somehow makes an entry through that immune system and really, really knocks them down. It's hard. And it's hard to watch my colleagues go through this who, you know, they didn't sign up for this. They didn't sign to come into work and care environments that they've never been trained for. You know, with like, there's days where we start our shifts and like I said, I work at a hospital that has money and has the resources. And there's days where we don't have PPE in the morning and we have to wait to go in to do our assessments until we get refilled.
Wow.
Yeah. And so it's really tough. It's really tough to care. You know, you don't even have families. That's something that has been really emotionally draining for me for the last month, has been that I really thrive being able to talk to my families that are there with the patient. And I genuinely feel like that's a big part of healing. Is, you know, having the family present and being able to teach them and talk them through what's going on and have their involvement in care. And right now we're not allowing anyone in the hospitals because this infection is so severe. And this virus is just it just runs so crazy. So no one has family members at the bedside, and it's been hard to navigate that. You know, we're also in this place too where, you know, especially when you're in a very pro-treatment side, you're treating and treating and treating, and then they look good one moment, then they don't look good another. And that's when we start to then call the family, because then we allow one family member to come in that we then, like, you know, glove, mask, gown, the whole 9 yards, and try to bring them in so they can be there if the patient is going to pass. But there's also sometimes no time for that. Sometimes it happens so quickly. Sometimes we have, you know, like a minute where you're taking a breath and they're like, oh, they look so good. And, you know, they have a really good day. And then you go in the next day and it's just like, boom, like, yeah. So it's been really tough.
And I just want to emphasize, like, Michelle isn't, again, we're not sharing this or talking about this to instill fear upon you. This is all to deepen your perspective. That's it. So if you're feeling that fear in your body rising right now from what she's sharing, take a deep breath and just collect this as perspective for you to widen your view on everything, for you to have a deeper understanding of what people are experiencing on the front lines, what's actually happening. And I love, Michelle, how you put it, that you actually have the privilege to see how, you know, the people who are getting sick, which all of us on the outside don't have that privilege. And there are families who have the privilege to see the beginning points of their loved ones getting sick, but they don't even see the full gamut of what can take place. And so, and I really love that you said privilege, because it is a real privilege, because that privilege allows you to have this more compassionate and wide view on what's taking place, which is why I love having you here talking about this. But for everyone at home listening, understand that you're lacking that privilege. Like maybe you've had it. Like I know 4 people have had it. And so you have that privilege of knowing how serious and unpredictable this virus can be. Maybe you've known some loved ones who have had it and gotten better, but you didn't have the privilege of seeing the full experience, the full journey of people going through it and the different variations of what this can look like. And so I just like really deeply honor you and the work that you're doing, and all the nurses and all the doctors on the front lines right now, because this is not just about your gifts and your skills and your tools. This is about like your own spiritual, mental, emotional well-being, and the energy and the presence that you're bringing into that space, for these people who don't even have the opportunity, who may not even have the opportunity to connect with their family again.
Yeah. And I can tell you that's been a really interesting thing as well. You know, seeing the way that every single person that is in the hospital right now working with these patients, they are demonstrating so much resiliency. And there's so much that they're coping with and handling on a day-to-day. Like there's not even time to pee sometimes. Sometimes we don't even get breaks. Like we've basically thrown away sometimes of like our human rights in order to just really stand up and serve. And so it's hard because that's so much of what needs to also change in the system, is that we need to treat these humans that are, you know, being compassionate and extending themselves forward. They also need to, you know, have that space within them reclaimed to be treated like a human.
Yeah.
But at the same time too, with what's going on right now, everyone is really stepping up. Everyone is really standing in. And, you know, we're in a very uncomfortable place right now. And we know that discomfort shapes you. And, you know, the reason I even speak to this being a privilege is because I went through a period in my life where I didn't realize that healthcare is a place where you need to take all of the unintegrated lessons and integrate them quickly, because otherwise those become traumas. And so much of my people are going to suffer through this and are suffering right now and will continue to suffer for months, if not years on end from this, because it comes and goes in waves. We had, you know, a beautiful, beautiful week, 1 week where we had, you know, 7 discharged to rehab, 7 that were on life support, were literally at death's door, that we put everything into. And we got to see them wheeled out to rehab. And I have videos of us just clapping in the hallway and seeing them go. To then coming on the next week, and within the first hour, we had 3 code and die on us. And then my patient asked me to remove care because he's been fighting for a month, and he just, at that point, he just knew that he was never going to recover the same way. And he knew his quality of life would never be the same. And so that was a very interesting place that brought me into this like nursing from my head versus my heart space. You know, navigating that place between of like, you know, where do I serve this system that times all my meds, that knows when I'm checking vitals, when I'm intervening, and all these things that are highly like watching me, but then I'm stopping what I'm doing to really hold the space and be with this human, because he doesn't even have family members there to do that with.
I said this before, and I'm going to say it again. I honor you for the work that you're doing, and everyone on the front line. And with that, we're nearing the end of this episode. And again, like this wasn't meant to offer you any any of you listeners truth or something to believe. If anything, we encourage you to start trusting yourself, to start using your own discernment in regards to what you choose to believe and what you don't, to understand that you haven't had the full privilege of seeing like everything that happens with COVID, and to lean into gathering perspective versus seeking out the truth, because there is no truth yet. Like, this is far too early for there to be any truth established. There's things that we know for certain, and some of those things have been mentioned here in regards to people getting sick. And yes, this affects people under the age of 45. And there's, you know, different ways of looking at things like these. We know for certain, but we don't know a lot of things for certain in regards to what's going to happen with the country reopening, what's going to happen if we chase herd immunity, what's going to happen this fall and winter. You know, we don't know that. And so, Michelle, any final thoughts for our listeners? Like, if there's one thing that you want them to walk away with, what would it be?
I would just touch on exactly what we're talking about, is just be open and be curious, you know, and not just around all the external media and stimuli and, you know, thoughts and perceptions of other people, but curious about yourself, with so much unknown and so much uncertainty and being stripped of those daily routines and rituals, and all the things that created that safety and certainty within us. A lot of us are in a place right now where we're learning to move forward in life based on what we're feeling and understanding feelings, because a lot of people have led their life so much by doing. And so when you see that post or you see that thing that triggers you, like, start by getting curious with yourself.
Mm-hmm.
What are your stories and beliefs around that? Why does that upset you? Because I feel like when you start to see your perspective lenses as well, you can actually lean and invite yourself more into a greater understanding.
Yeah. And how much nicer would the world of social media be if everyone took that lens of understanding and curiosity versus the lens of like judgment and I'm right, you're wrong.
Mm-hmm.
Yeah. So, Michelle, thank you so much for just sharing your presence, your energy, your experience with everyone today. Where can they find you online if they want to say hi and reach out and get more of your energy? What's a good place for them to find you?
Yes. So a great place right now is Instagram. Like you said as well, Ruby, I'm limiting my social media, trying to just stay in my truth and stay in alignment with me. So I'm doing all of my stuff on Instagram at the moment. So my handle is just my full name, Michelle Fairney.
Awesome. I'm going to have that link in the show notes for all of you. Michelle, thank you again. And to our listeners, thank you so much for joining us on what is really a very special episode of Today's Thought Leader. Be sure to drop a rating and review on iTunes, and please share this episode with a friend. If there's someone who needs a perspective shift or someone who just really wants to hear something that is not claiming to be the truth, but just an opportunity to open your mind, please share this with them. And then if you have any questions for myself or Michelle, reach out to us on social media. You can also text me at 1-781-336-0160. And then I will see you back here on Monday for a brand new episode of Today's Thought Leader, where I chat with my human design channel and coach, AC Brown, about all things human design. Thanks, everyone.